Hello viewers, look at that picture. That picture in my laptop, what are you seeing? That's a newborn baby who has just been given birth to, holding an Iucd in its hand. I've heard about this thing being discussed by friends and clients. Is it true that a woman can give birth to a baby holding an Iucd, for a woman who has been using Iucd as a method of family planning previously? Well, I won't say no, because this is a real picture. It can happen. So what can make this to happen? This happens when an Iucd moves from its original place, when it's out of place. An Iucd, when it's in place, is supposed to adhere to the fundus of the uterus to prevent implantation. But there are some things that can cause it to move out of place. The major thing that causes an Iucd to move out of place is contraction. You call it cramps. So what causes cramps? Cramps can be caused by a hormone called oxytocin for mothers who are breastfeeding. This hormone causes the uterus to contract. It can cause cramps. Another thing that can cause cramps is menses. Another thing that can cause cramps is an infection. Another thing that can cause cramps is it normally happens naturally, a few days, weeks, months after insertion of this device, as an attempt to expel it. The uterus will think that it is a foreign body. So anytime a lady has cramps, she's supposed to come back for checkup. We check if the Iucd has been displaced or not. We'll send you for an ultrasound, or we can just take history from you to confirm what could have happened. There is a way by which you can also check for its position at home. You can wash your hands properly and feel for the strings. Normally when we insert the Iucd, we explain to ladies how to feel for the string. If the string is longer than it should be, if you can't feel the string, or maybe if you are trying to feel for the string but you feel something plastic in the cervix, it means that it is out of place. Sometimes the uterus can tilt. Sometimes if it is placed immediately after delivery, and involution has to take place, meaning that the uterus has to contract back to its original shape, it can also get displaced. So ladies, if you don't want this to happen, make sure that anytime you have cramps, you come back for checkup. It can happen, we don't say no, but it can be prevented. Remember that the success rate of this device is 99%, meaning that if a lady comes and she chooses this method, she can be on the side of 99% of ladies who will use it successfully. But she can also be on the side of 1% of ladies who will conceive while on it. So if you are on this method, please, if you have any cramp, please come back for checkup. This is so true. So this baby is holding this device because babies, when they are born, they have something we call a reflex of grasp that enables them to hold anything that comes into contact with their hands. That's why the baby is holding it. Maybe it got into contact with the baby's hands somewhere along the way. So you don't want this to happen. Please come back for checkup.